Welcome to the Buckingham Center for Facial Plastic Surgery video series. This video is going to talk about scar revision. So scarring can come in multiple forms. It can be from injury, where you suffer a laceration of the face. It can be from a burn. It can be from a previous surgical procedure. So it's a very broad topic that's going to prevent me from talking about the specifics of those different things. So we're going to talk about it in a little bit more broad terms related to that. So scarring typically comes in two forms, either hypertrophic or atrophic. Most scars are atrophic, and what that means is that the scars tend to be flat, they tend to be white, and they tend to be widened. Hypertrophic scars tend to be more acute scars and are scars that have a buildup around them. Some people would call that a keloid, although a keloid is really a separate entity where that hypertrophy or thickening extends beyond the natural scar margins. That's a more rare condition. So hypertrophy just means that the scar has been thickened. In either case, when we're dealing with scars, we're really talking about methods to correct them being skin resurfacing and surgical excision of the scar. Oftentimes we combine skin resurfacing with surgical excision, where we do the surgical excision first and then followed by the skin resurfacing. The skin resurfacing that we use for scars is dermabrasion. So surgical excision of a scar happens when, again, you have that atrophic scar or hypertrophic scar, and you need to remove that skin to get it into a condition where you can then close the wound and then use dermabrasion to improve it after the scar has been healed. Removing the scar takes place in different methods depending upon the orientation of the scar. So we all have natural wrinkle lines in our face. We refer to those as the relaxed skin tension lines. When a scar is oriented along those relaxed skin tension lines, or the scar is oriented so that it falls into the natural junctions of the face, so say the smile line or just in front of the ear, those areas conceal scars very well. They can still be visible if they're too wide or atrophic or hypertrophic, but you can remove those scars and leave the orientation of the scar in the same direction because it'll already be hidden in the natural facial units. For scars that are running contrary to those natural facial units, we need to do other things to improve those. The other things to improve those typically either consist of using Z-plasties or using some sort of a broken geometric shape to excise the scar. So if you think about a scar on a person's face, your mind's eye is really drawn to the long linear nature of the scar. And so if you can break up the linear nature of that scar into smaller pieces, it creates the illusion that the scar is not there. So say, for example, you have a scar running on your cheek that's going in this direction, which is contrary to the direction it should be going in the relaxing tension lines. To treat that scar, we would excise that scar, but in so doing, we would break it up into smaller pieces, typically geometric shapes that alternate, say, circle, square, triangle, just for example. Those triangles and squares are then excised on each side, creating a lock and key pattern. So the circle on one side is oriented with the circle on the other, and as those fit together, you get this circular shape. So you'd end up with, say, a scar that has a circle, and then a square, and then a triangle that are broken down into little 5-millimeter pieces that then make the scar not one linear configuration, but a very small bunch of different configurations running different directions that then confuses the eye and allows the scar to be much more invisible. Sometimes that's enough, and you don't need to come back and do any surgical resurfacing after that, but sometimes you need to come back after that and do dermabrasion, which is literally, again, a sanding procedure where we take a device that produces a rotation, and it has a bit or a burr with little nodules on it that are made out of diamond, actually. And you come along and you just sand that scar and the surrounding skin, which then allows the skin to grow up from the edges and below, further concealing that geometric broken line closure that we've already done. If the scar is oriented in these linear areas, we just basically need to excise that scar in the natural junction with or without dermabrasion. That's a much more easy situation to deal with. So that's kind of the basics of scar revision. So it very much depends upon what type of scar it is, what location it is, what the orientation of it is, and then we tailor a treatment to give the best possible results in the individual case.